Welcome back to QBankPro Academy. In this video, we will review nursing licensing exam questions. Please check out our resources in the description below that includes links to a free NCLEX course and to our website that has practice exams, quizzes, flashcards, and more. Let's get started.
The nurse is assessing a 24-year-old female patient with depression. The nurse expects the patient's record to document. Select all that apply. A. Sleep disturbance. B. Hyperalertness. C. Low self-esteem. D. Increased energy. The correct answer is A. Sleep disturbance and C. Low self-esteem. Explanation. Depression may persist for 2 weeks or wax and wane over years. Patients may experience low mood, low self-esteem, guilt, helplessness, fatigue, and social withdrawal. Sleep, affect, and appetite may be affected. What are the most common long-term symptoms that the nurse would expect in a patient with COVID-19? Select all that apply. Fatigue, nausea, vomiting, shortness of breath, gastroesophageal reflux. The correct answer is fatigue and shortness of breath. Explanation. Long-term COVID symptoms have been referred to as long COVID or post-COVID syndrome. Symptoms include respiratory symptoms, fatigue, anemia, gastrointestinal disorders, headaches, muscle weakness, and others. The nurse receives a patient from the operating room after gastrectomy. What is the best position to put the patient in after gastrectomy? A. Supine. B. Trendelenburg. C. Low Fowler's. D. Sims position. The correct answer is C. Low Fowler's. Explanation. Low Fowler's position reduces post-operative abdominal pain, back pain, and the risk of aspiration. It may be used post-procedure for these reasons. Low Fowler's position is often referred to as the sitting position. A 43-year-old male with renal failure and pneumonia is in the ICU. His decreased BUN and creatinine ratio may indicate. Select all that apply. A. An anabolic state. B. An increase in creatinine only. C. A catabolic state. D. Dehydration. The correct answer is C. A catabolic state and D. Dehydration. Explanation. Note in this question you are asked about the ratio, BUN to creatinine. Decreased BUN creatinine ratio may indicate a high protein diet, increased catabolism, or dehydration. Critically ill patients with prolonged illness are in a catabolic state that leads to weight loss and loss of muscle mass.
In a patient diagnosed with myocardial infarction and crushing chest pain, priority should be given to administering what medication? A. Intravenous fluids. B. Morphine sulfate. C. Heparin. D. Oxygen. The correct answer is B. Morphine sulfate and D. Oxygen. Explanation. MONA, or MONA, is the mnemonic used to remind students of the pre-hospital treatment for acute myocardial infarction. MONA refers to morphine, oxygen, nitrates, and aspirin.
The nursing student is caring for a new patient with kidney transplant. The nursing student asks the nurse about kidney transplant surgery. The nurse correctly answers. Select all that apply. A. Kidney transplant involves implanting a kidney from a compatible donor in patients with irreversible kidney damage. B. Recipients are not screened for COVID-19. C. Donors may be a living related donor or unrelated to the recipient. D. Donors may be individuals with irreversible brain injury. The correct answer is A. Kidney transplant involves implanting a kidney from a compatible donor in patients with irreversible kidney damage. C. Donors may be a living related donor or unrelated to the recipient. And D. Donors may be individuals with irreversible brain damage. Explanation. Kidney transplant occurs in patients who are immunosuppressed The transplant patient, as well as the donor, is screened for a number of infections that may increase the risk for the transplant recipient, including COVID-19. A, C, and D are correct. What comorbidities are associated with severe illness and mortality in patients with COVID-19? Select all that apply. Hypothyroidism, obesity, anorexia, cardiovascular disease. The correct answer is obesity and cardiovascular disease. Explanation. There are a number of comorbidities that predict worse outcomes for patients and increase the risk of morbidity or mortality in patients with COVID-19. The nurse is speaking with a mother whose teenage daughter is diagnosed with bipolar disorder. What are findings that the mother should be told that indicate worsening symptoms? Select all that apply. A. Excessive sleeping. B. Rapid speech. C. Increased watching television. D. Increased self-regard. The correct answer is B. Rapid speech, and D. Inflated self-regard. Explanation. Bipolar disorder results in mood swings that include mania and depression. Treatment is effective with medication. Mania is characterized by high energy, extreme self-confidence, quick anger, and excessive financial spending. Depression may be characterized by extreme lows. What dietary changes related to liquid intake during meals can be made to reduce dumping? A. Drink 8 to 16 ounces of water with meals. B. Drink liquids prior to consuming solid food. C. Consume roughage, salad prior to meals. D. Limit fluids during the meal to slow the transit of the food. The correct answer is D. Limit fluids during the meal to slow the transit of the food. Explanation. Dumping may occur in patients who have had gastric surgery to remove a portion of the stomach. The food moves too quickly from the stomach into the intestine. Drinking between meals rather than during meals may reduce symptoms. The nursing student asked the nurse about a patient with chronic kidney failure. Appropriate nursing interventions include: select all that apply. A. Administer intravenous fluid D5 normal saline with 20 milliequivalents per liter of potassium chloride at 125 cc's per hour. B. Administer the prescribed diet, low to moderate protein, high carbohydrate. C. Teach the patient about dietary restrictions. D. Administer potassium phosphate, K-phos, twice a day. The correct answer is B. Administer the prescribed diet, low to moderate protein, high carbohydrate. And C. Teach the patient about dietary restrictions. Explanation. A and D would likely cause an adverse outcome. The high sodium in the normal saline and the rate at 125 cc's per hour would lead to fluid overload. Potassium as ordered in A and D are contraindicated in this patient with kidney failure. The nursing student asked the nurse care practitioner about antidepressant medications for a patient with depression who also has insomnia. The nurse correctly answers A. Doxepine, B. Imipramine, C. Nortriptyline, D. Trazodone. The correct answer is D. Trazodone. Explanation. Trazodone potentiates the effects of serotonin, causing an increase in mood. One of its therapeutic effects is an increase in sleep time that helps patients with insomnia. The exam will ask about nursing care of patients with mental disorders and treatments. The nurse is taking care of a patient with renal failure. What labs are used to assess renal function? Select all that apply. A. BUN, B. Amylase, C. Chlorine, D. Creatinine. The correct answer is A. BUN, and D. Creatinine. Explanation. 3 important diagnostic tests that you should be familiar with are creatinine, an indicator of glomerular filtration rate, BUN, an indicator of protein metabolism, and the BUN-creatinine ratio. All three tests are used to assess renal function. The exam will ask about care of acute renal failure and diagnostic testing. The nurse receives a patient from the operating room after surgery. The advantage of low Fowler's position after abdominal surgery is A. The patient is lateral. Should he or she vomit? B. There is no advantage. C. It reduces the risk of bleeding. D. Low Fowler's relaxes the abdominal muscles. The correct answer is D. Low Fowler's relaxes the abdominal muscles. Explanation. Low Fowler's position reduces post-operative abdominal pain, back pain, and the risk of aspiration. Disadvantages of low Fowler's position include a decrease in venous return and an increased risk of venous embolism.
The nurse in the intensive care unit receives a patient from the operating room. Blood pressure monitoring in a patient with IV nitroglycerin necessitates the use of A. Continuous blood pressure monitoring and arterial line, B. Well-fitted blood pressure cuff, C. Doppler ultrasound, D. Echocardiography. The correct answer is A. Continuous blood pressure monitoring and arterial line. Explanation. The most appropriate choice here is A. C and D are diagnostic tests that are commonly used. Remember the pharmacology of nitroglycerin. It is very effective at vasodilatation and may cause hypotension. Close monitoring of the blood pressure is important. The nurse assesses a patient with suspected blood clot in a deep vein of the lower extremities of the pelvis. Pain and swelling in the patient's right calf can be an indication of what condition? A. Ischemia. B. Deep vein thrombosis. C. Sepsis. D. Liver failure. The correct answer is B. Deep vein thrombosis. Explanation. Deep vein thrombosis is a condition where a clot forms in the deep veins of the leg or pelvis. Although less common, DVT can occur in the arms. Patients with DVT are at risk for pulmonary embolism if the blood clot moves to the lungs.
The nurse is caring for a 26-year-old male inpatient diagnosed with bipolar disorder and mania. What interventions will the nurse take? Select all that apply. A. Encourage group activities. B. Speak calmly and use slow interactions. C. Avoid arguing with the patient. D. Organize team sport activities for the patient. The correct answer is B. Speak calmly and use slow interactions. And C. Avoid arguing with the patient. Explanation. When caring for a patient with bipolar disorder and acute mania, the nurse should avoid exciting the patient and provide a safe environment. Prescribed medications should be administered under observation to ensure compliance. The nurse is caring for a patient after gastrectomy. What positional changes can be made to reduce the risk of dumping? A. Walking for 15 minutes after eating. B. Reclining for a period after eating. C. Standing for 20 minutes after eating. D. Lateral decubitus position for 15 to 30 minutes after eating. The correct answer is B. Reclining for a period after eating. Explanation. To reduce dumping, patients will try to reduce the transit time that the food moves. Patients may recline or remain in low Fowler's position for a period after eating. A and C may increase the symptoms of dumping syndrome. The nursing student asks her instructor about COVID-19. The nurse correctly states, select all that apply. Fatality rates are higher among outpatients, patients treated at home. Fatality rates are higher among hospitalized patients. Kawasaki disease is more common in the elderly. Fatality rates are higher among older patients and the elderly. The correct answer is fatality rates are higher among hospitalized patients. And fatality rates are higher among older patients and the elderly. Explanation. Risk factors include age and hospitalization. Patients who are stable enough to remain at home have better outcomes. A patient with major depressive disorder is reporting his symptoms over the last 3 weeks. The nurse expects to document Select all that apply. A. Weight loss. B. Hypervigilance. C. Helplessness. D. Lack of desire to spend time with friends and family. The correct answer is A. Weight loss, and D. Lack of desire to spend time with friends and family. Explanation. Moderate and severe depression causes sleep disturbance, irritability, anxiety, and may increase the use of substances, including drugs and alcohol. The UAP asked the nurse about dialysis. All the following statements are true about hemodialysis. Select all that apply. A. The most common cause for urgent dialysis is hypokalemia. B. Hemodialysis is a process that allows the removal of excess fluid. C. Hypovolemia is a common cause for dialysis in hospitalized patients. D. Hemodialysis is a process used to clean the patient's blood, replacing the function of the kidney. The correct answer is B. Hemodialysis is a process that allows the removal of excess fluid. And D. Hemodialysis is a process used to clean the patient's blood, remove waste, replacing the function of the kidney. Explanation. Hyperkalemia and hypervolemia are more common in patients with renal failure requiring dialysis. For the exam, you should understand the difference between the terms hemodialysis and peritoneal dialysis. Why is irrigating an NG tube post-gastrectomy by anyone except the surgeon ill-advised? A. The NG tube may be irrigated by the nursing staff. B. Irrigating the tube may disrupt the suture line. C. The NG tube may be irrigated by the UAP. D. Irrigating the tube may cause vomiting. The correct answer is B. Irrigating the tube may disrupt the suture line. Explanation. After gastrectomy, the nasogastric tube is used for decompression and to prevent post-operative ileus. Immediately after surgery, the new suture line is at risk for disruption. What is the appropriate therapeutic lithium blood level? A. 1 to 3.2 milliequivalents per liter. B. 0.2 to 0.8 milliequivalents per liter. C. 0.6 to 1.2 milliequivalents per liter. D. 2.6 to 8.2 millimoles per liter. The correct answer is C. 0.6 to 1.2 milliequivalents per liter. Explanation. The therapeutic drug level of lithium is 0.6 to 1.2 milliequivalents per liter. When therapy is first begun, the level must be monitored closely. Signs of lithium toxicity include ataxia, muscle twitching, hyperreflexia, and seizures. The nurse is taking care of a 56-year-old diabetic female receiving dialysis 3 days a week. What are some risk factors associated with chronic kidney disease? Select all that apply. A. Bleeding. B. Neurological symptoms. C. Hypomagnesemia. D. Hypophosphatemia. The correct answer is A. Bleeding, and B. Neurological symptoms. Explanation. GI bleeding may occur in patients because the increased urea level leads to an increase in ammonia. Ammonia irritates the gastrointestinal mucosa, resulting in bleeding. Elevated magnesium and potassium are more common. Confusion and decreased level of consciousness may occur. The nurse's patient returns to the ward after cystoscopy. What are the appropriate nursing interventions? Select all that apply. A. Assess the patient's vital signs. B. Restrict fluid intake. C. Keep the patient NPO until return of bowel function. D. Monitor urine for bleeding. The correct answer is A. Assess the patient's vital signs, and D. Monitor urine for bleeding. Explanation. As usual, when a patient returns from an invasive procedure, assess and document the vital signs. The exam would expect you to know that cystoscopy involves an endoscopic examination of the bladder, and the nurse will monitor for post-bleeding. Fluids are encouraged post-cystoscopy.
A patient is admitted to the emergency department with a myocardial infarction. In a patient with myocardial infarction 48 hours ago who has a new murmur, the nurse should worry about A. Sepsis, B. Sudden deterioration and change in vital signs, C. Gastroesophageal reflux, D. Pulmonary edema. The correct answer is B. Sudden deterioration and a change in vital signs. Explanation. Murmurs occurring after myocardial infarction may indicate papillary muscle infarction and rupture. When this occurs, a new murmur may be heard. Patients may deteriorate suddenly with the change in vital signs. A, C, and D do not typically present with a new murmur. In a patient with a confirmed myocardial infarction with new onset decline in urinary output, 80 cc's in the last 8 hours, despite adequate fluid intake, the nurse should be concerned about select all that apply. A. Pulmonary embolism. B. Dehydration. C. Acute renal failure. D. The healthcare provider should be contacted. The correct answer is C. Acute renal failure, and D. The healthcare provider should be contacted. Explanation. Acute myocardial infarction may result in low blood pressure and hypoperfusion of the kidneys. Acute renal failure and acute renal injury may occur. The healthcare provider should be contacted. Pulmonary embolism and dehydration are incorrect. Rule out B because the question states despite adequate fluid intake. A patient is admitted to the emergency department with suspected myocardial infarction. In this patient, what laboratory result is diagnostic for myocardial infarction? A. Troponin, B. Lactate, C. Hemoglobin, D. Myoglobin index. The correct answer is A. Troponin. Explanation. Troponin is a biomarker of cardiac injury that is detected in the serum by a blood test when myocyte or heart cells die. The combination of elevated troponin and evidence of clinical ischemia assist in the diagnosis of myocardial infarction. The nurse is assessing a patient with bradycardia. What is the treatment for asymptomatic bradycardia? A. Monitor the patient and document the vital signs in the record. B. Cardiopulmonary resuscitation. C. Transcutaneous pacing. D. Digoxin. The correct answer is A. Monitor the patient and document the vital signs in the record. Explanation. Sinus bradycardia, or heart rate below 60 beats per minute, may occur in athletes and some well-conditioned healthy individuals. In these individuals, in whom there is no cardiovascular compromise or hemodynamic consequences, healthcare providers generally will not initiate treatment. A patient whose heart rate changes from 72 to 51 and blood pressure changes from 110/84 to 89/64 should be treated with select all that apply. A. Aspirin. B. Cardiopulmonary resuscitation. C. Transcutaneous pacing. D. Atropine. The correct answer is C. Transcutaneous pacing and D. Atropine. Explanation. Of the choices provided, C and D are the best answers. Atropine is a drug that increases heart rate. It is typically given intravenously, although there are other routes of administration. Transcutaneous pacing may be used for symptomatic bradycardia.
All of the following statements are true about access for hemodialysis. Select all that apply. A. Hemodialysis arteriovenous fistulas are assessed by the nursing staff palpating a frill over the skin of the fistula site. B. Peritoneal dialysis is accomplished by placing a small access catheter into the subclavian or femoral vein. C. A complication of peritoneal dialysis is bacterial peritonitis. D. Hemodialysis catheters are placed in the subclavian or femoral vein. The correct answer is A. Hemodialysis arteriovenous fistulas are assessed by the nursing staff palpating a thrill over the skin of the fistula. C. A complication of peritoneal dialysis is bacterial peritonitis. And D. Hemodialysis catheters are placed in the subclavian or femoral vein. Explanation. Hemodialysis, HD, involves removal of the blood out of the body. The blood is cleansed by a machine. Peritoneal dialysis uses the peritoneal lining of the abdominal cavity to act as a filter. Hemodialysis access refers to how the blood is removed from the body. Preventing or decreasing the risk of gastrointestinal bleeding includes all of the following. Select all that apply. A. Avoid administering aspirin. B. Monitor PT, APTT. C. Avoid administration of NSAIDs. D. Avoid administration of vitamin K. The correct answer is A. Avoid administering aspirin. B. Monitor PT and APTT. And C. Avoid administration of NSAIDs. Explanation. Two medications associated with an increase in bleeding are aspirin and NSAIDs. For this reason, these medications should be avoided in patients with kidney disease. Assessing PT and PTT is a valuable indicator of coagulopathy. The exam asks about care of the most common renal disorders, critical labs, and dialysis. The nurse is caring for a post-op patient. Which statements are true about diagnostic testing for kidney function? Select all that apply. A. Creatinine is a laboratory test that assesses the rate of hemolysis, red blood cell breakdown. B. Creatinine is a laboratory test that indicates glomerular filtration. C. BUN creatinine ratio is the creatinine level divided by the BUN level to determine the ratio. D. BUN is a laboratory test that indicates the amount of urea in the blood, a byproduct of protein metabolism. The nurse is interviewing a patient with COVID-19. What statements are true about close contacts? Select all that apply. Neonates born to mothers with COVID-19 are tested. COVID-19 testing is not recommended before surgical procedures. Asymptomatic testing for COVID-19 patients may be recommended in congregate living areas, for example, in nursing homes and prisons. COVID-19 testing is not needed prior to organ transplantation. The correct answer is neonates born to mothers with COVID-19 are tested, and asymptomatic testing for COVID-19 may be recommended in congregate living areas, for example, in nursing homes and prisons. Explanation. COVID-19 testing may be recommended in some patients undergoing invasive procedures. Asymptomatic testing may be recommended in congregate living facilities. The correct answer is B. Creatinine is a laboratory test that indicates glomerular filtration. And D. BUN is a laboratory test that indicates the amount of urea in the blood, a byproduct of protein metabolism. Explanation. When the BUN and creatinine levels increase, this may be an indication of renal dysfunction. The BUN level divided by the creatinine is the BUN creatinine ratio.
A patient is admitted to the emergency department with a myocardial infarction. In a patient with myocardial infarction 48 hours ago who has a new murmur, the nurse should worry about A. Sepsis, B. Sudden deterioration and change in vital signs, C. Gastroesophageal reflux, D. Pulmonary edema. The correct answer is B. Sudden deterioration and a change in vital signs. Explanation. Murmurs occurring after myocardial infarction may indicate papillary muscle infarction and rupture. When this occurs, a new murmur may be heard. Patients may deteriorate suddenly with the change in vital signs. A, C, and D do not typically present with a new murmur. In a patient with a confirmed myocardial infarction with new onset decline in urinary output, 80 cc's in the last 8 hours, despite adequate fluid intake, the nurse should be concerned about select all that apply. A. Pulmonary embolism. B. Dehydration. C. Acute renal failure. D. The healthcare provider should be contacted. The correct answer is C. Acute renal failure, and D. The healthcare provider should be contacted. Explanation. Acute myocardial infarction may result in low blood pressure and hypoperfusion of the kidneys. Acute renal failure and acute renal injury may occur. The healthcare provider should be contacted. Pulmonary embolism and dehydration are incorrect. Rule out B because the question states despite adequate fluid intake.
Obtaining a urine specimen for urinalysis in a 23-year-old female who may have a urinary tract infection includes Select all that apply. A. Drinking 16 ounces of water prior to providing a specimen. B. Washing the perineal area prior to voiding. C. Obtain the first morning void if possible. D. Document menstruation on the requisition if present. The correct answer is B. Washing the perineal area prior to voiding. C. Obtain the first morning void if possible. And D. Document menstruation on the requisition if present. Explanation. Instructing patients about the correct steps for obtaining a urinalysis sample is important. Cleansing the perineal area helps limit contamination. Red blood cells, RBCs, may be present in a sample during menstruation. The nurse must collect a 24-hour urine collection. What nursing interventions are important for the specimen collection? A. Explain to the patient that a 24-hour urine collection will be done. B. The specimen may be collected for 12 to 24 hours. D. Instruct the patient that only voids greater than 60 mils will be added to the collection. D. Keep the urine specimen on ice and refrigerate it during the collection. The correct answer is A. Explain to the patient that a 24-hour urine collection will be done, and D. Keep the urine specimen on ice and refrigerate it during the collection. Explanation. 24-hour urine collection is a common laboratory test. Educating the patient about the 24-hour collection will avoid the patient discarding a sample. All the urine during the 24-hour period should be collected. Collected specimens will be kept cold, on ice, or refrigerated. A patient is admitted to the emergency room with heat stroke. All the following are true about specific gravity. Select all that apply. A. An elevated specific gravity may mean fluid overload. B. Normal specific gravity is between 1.005 and 1.030. C. An elevated specific gravity suggests a volume deficit. D. A low specific gravity may indicate renal dysfunction. The correct answer is B. Normal specific gravity is between 1.005 and 1.030. C. An elevated specific gravity suggests a volume deficit. And D. A low specific gravity may indicate renal dysfunction. Explanation. The kidney's ability to concentrate urine may be assessed by the specific gravity laboratory test. Hypervolemia results in a low specific gravity. Hypovolemia results in a high specific gravity. The nurse is caring for an inpatient with mania who is diagnosed with bipolar disorder. What are important strategies for activities? Select all that apply. A. Encouraging competitive sport activities. B. Set limits for inappropriate behavior. C. Keep hazardous objects away from the patient. D. Encourage the patient to talk about their feelings. The correct answer is B. Set limits for inappropriate behavior. C. Keep hazardous objects away from the patient. And D. Encourage the patient to talk about their feelings. Explanation. Bipolar disorder results in mood swings that include mania and depression. Mania is characterized by high energy, extreme self-confidence, quick anger, and excessive financial spending. What are presenting signs and symptoms of COVID-19 in children? Fever, reflux, chills, cough. The correct answer is fever, chills, and cough. Explanation. This question is asking about the presentation of COVID-19 in a pediatric patient. COVID-19 signs and symptoms may be different in children and neonates. The patient tells a nurse he was prescribed a drug to treat depression and mood that blocks the reuptake of serotonin in the brain. The nurse expects the medication record to show. Select all that apply. A. Doxepin. B. Citalopram. C. Imipramine. D. Fluoxetine. The correct answer is B. Citalopram, and D. Fluoxetine. Explanation. This question examines if the nursing student recognizes the class of drugs known as serotonin reuptake inhibitors, SSRIs. Citalopram and fluoxetine are examples of common SSRIs. What are pre-procedural nursing priorities for a patient undergoing a renal biopsy at 10 a.m. in the morning? Select all that apply. A. Patients may eat a regular diet for breakfast. B. Confirm that an informed consent is obtained. C. Administer 2 units of fresh frozen plasma before the procedure. D. Confirm that coagulation and clotting studies are normal if ordered. The correct answer is B. Confirm that an informed consent is obtained, and D. Confirm that coagulation and clotting studies are normal if ordered. Explanation. Renal biopsy is an invasive procedure that involves inserting a needle into the kidney to obtain a tissue sample. Normal coagulation and clotting studies indicate a lower risk of bleeding during the procedure and post-procedure. A patient who underwent aortic aneurysm repair is diagnosed with acute renal failure. What are the nursing priorities? A. Place a non-rebreather mask and administer 100% oxygen. B. Transfuse 6 units of platelets. C. Prepare the patient for intubation. D. Monitor intake, output, and daily weights. The correct answer is D. Monitor intake, output, and daily weights. Explanation. All the interventions listed above are important in critical patients, but they are not indicated in a patient with acute renal failure based on the information that is given in the question. You are not told that respiratory status is compromised or that the patient is bleeding. Eliminate A, B, and C. A father tells a nurse that his son was started on a tricyclic antidepressant for depression. The nurse expects the boy's medication record to show. Select all that apply. A. Doxepin. B. Citalopram. C. Nortriptyline. D. Bupropion. The correct answer is A. Doxepin, and C. Nortriptyline. Explanation. This question will determine if the nursing student recognizes the class of drugs known as tricyclic antidepressants, or TCAs. Doxepin and nortriptyline are examples of common TCAs. The nurse is speaking with a mother whose teenage son is being treated for depression and narrow angle glaucoma. What are some drugs that should be avoided? Select all that apply. A. Doxepin. B. Imipramine. C. Nortriptyline. D. Phenelzine. How are you doing on these exam questions? Check out the links below this video for more great resources. The correct answer is A. Doxepin, B. Imipramine, and C. Nortriptyline. D. Phenelzine is not a tricyclic antidepressant. A, B, and C are tricyclic antidepressants, and this class of drugs should not be prescribed to patients with narrow angle glaucoma. The nurse is assigned to take care of a hospitalized patient with COVID-19. What orders does the nurse expect to find on the chart? Dexamethasone, oxygen, monoclonal antibodies, Coumadin. The correct answer is dexamethasone, oxygen, and monoclonal antibodies. Explanation. In this question and the one that follows, you are asked to distinguish between the treatments for hospitalized and non-hospitalized patients. It is important to remember the treatments are different depending on the setting. A patient who underwent aortic aneurysm repair was diagnosed with acute renal injury 24 hours ago. What are appropriate nursing interventions? A. Monitor hourly intake and output. B. Start a norepinephrine Levophed intravenous drip. C. Start a dobutamine intravenous drip. D. Monitor mental status change and consciousness that may be affected by uremia. The correct answer is A. Monitor hourly intake and output, and B, monitor mental status change and consciousness that may be affected by uremia. Explanation: the urine output may be decreasing during this period, and further medical interventions will be done. Increasing urea and ammonia levels may adversely affect the patient's mental status. B may worsen outcome, and C is not indicated based on the information that you have. The UAP asked the nurse about a patient with chronic kidney disease. The nurse correctly answers. Select all that apply. A. Chronic kidney disease is defined as kidney disease present for over 14 days. B. Chronic kidney disease is a slow loss of kidney function over time. C. Patient's level of consciousness should be monitored because of the risk of increasing urea. D. Patients may have symptoms of fluid overload or hypervolemia. The correct answer is B. Chronic kidney disease is a slow loss of kidney function over time. C. Patient's level of consciousness should be monitored because of the risk of increasing urea. And D. Patients may have symptoms of fluid overload or hypervolemia. Explanation: chronic kidney disease is defined as specific symptoms being present for at least 3 months. There are many causes, including diabetes and hypertension. Acute kidney injury may lead to chronic kidney disease. What are some risk factors associated with chronic kidney disease? Select all that apply. A. Hypokalemia. B. Anemia. C. Metabolic acidosis. D. Hypervolemia. The correct answer is B. Anemia, C. Metabolic acidosis, and D. Hypervolemia. Explanation: hyperkalemia, metabolic acidosis, and hypervolemia is more likely in a patient with chronic kidney disease because the patient is not making urine. The other finding, hypokalemia, is not common in patients with renal failure and chronic kidney disease.
The nurse in the intensive care unit receives a patient from the operating room with nitroglycerin ordered. Administration of intravenous nitroglycerin requires. Select all that apply. A. Hourly arterial blood gas draws. B. Monitoring blood pressure. C. Transcutaneous pacing. D. An infusion pump. The correct answer is B. Monitoring blood pressure, and D. An infusion pump. Explanation: nitroglycerin may be administered by several routes, including oral, transdermal, sublingual, and intravenously. When given intravenously, care should be taken, and this includes close monitoring of the blood pressure for hypotension and the use of an infusion pump. The nurse is assessing a patient with a myocardial infarction 48 hours ago and hears a new murmur. The nurse should consider what new cardiac abnormality: A. Aortic rupture. B. Pericarditis. C. Papillary muscle infarction. D. Endocarditis. The correct answer is C. Papillary muscle infarction. Explanation: myocardial infarction and papillary muscle infarction and necrosis may result in serious complications. When rupture occurs and mitral regurgitation results, it may be heard on physical examination as a new murmur. The nurse is providing instructions about a patient's discharge medication. What are adverse reactions of clopidogrel or Plavix? Select all that apply. A. Jaundice. B. Bleeding, major and minor. C. Agranulocytosis. B. Thrombocytopenic purpura. The correct answer is B. Bleeding, major and minor. C. Agranulocytosis. And D. Thrombocytopenic purpura. Explanation: clopidogrel may be given to patients with myocardial infarction. It benefits these patients by reducing platelet aggregation. Risk factors that must be considered are increased bleeding and hypersensitivity reactions, such as hives and angioedema.
What statements below are true about COVID-19 testing? Select all that apply. Testing is unnecessary during flu season if the incidence of COVID-19 in the community is low. Patients suspected of COVID-19 infection who are symptomatic should be tested for COVID-19. Serology testing is the most common initial test for patients suspected of COVID-19. If testing is not available, the diagnosis of COVID-19 can be made presumptively based on the risk of exposure and clinical signs and symptoms. The correct answer is patients suspected of COVID-19 infection who are symptomatic should be tested for COVID-19. And if testing is not available, the diagnosis of COVID-19 can be made presumptively based on the risk of exposure and clinical signs and symptoms. Explanation. Patients who present with signs and symptoms consistent with COVID-19 should be tested. A presumptive diagnosis may be made and quarantine may be initiated. Your history and exam are important, especially if you do not have testing available or testing is done late in the infection. The nurse is interviewing a patient with suspected COVID-19. What statements are true about close contacts? Select all that apply. After exposure to COVID-19, testing should occur as soon as possible. A close contact is only defined as a member of one's household. After a COVID-19 exposure, if the first test is negative and the patient is still symptomatic, retesting is done. Neonates born to mothers with COVID-19 do not need to be tested. The correct answer is, after exposure to COVID-19, testing should occur as soon as possible. And after a COVID-19 exposure, if the first test is negative and the patient is still symptomatic, retesting is done. Explanation. The CDC defines a close contact more broadly. History and exam are important and may guide retesting in some patients. All the following statements are true about using the subclavian vein hemodialysis catheter. Select all that apply. A subclavian vein catheter is a permanent catheter used for dialysis long-term. B, the catheter is usually filled with heparin between dialysis treatments. C, patients may use a subclavian vein catheter at home for dialysis. D, the catheter should only be used for dialysis treatments. The correct answer is B, a subclavian vein catheter is a permanent catheter used for dialysis long-term. And D, the catheter should only be used for dialysis treatments. Explanation. The subclavian vein catheter is a temporary catheter that can be used for dialysis until a permanent hemodialysis access is made surgically. C. Patients should never attempt to use the hemodialysis catheter. Specially trained nurses and other medical staff will use the catheter during dialysis. A 60-year-old male with a history of urinary retention and prostate disease is being evaluated at the mental health clinic. What drugs will not be appropriate for cyclothymic disorder? Select all that apply. A. Citalopram. B. Bupropion. C. Nortriptyline. D. Fluoxetine. The correct answer is C. Nortriptyline. Explanation. C. Nortriptyline is a tricyclic antidepressant, TCA. This drug potentiates norepinephrine and serotonin in the central nervous system and elevates mood. Drugs in this class should be avoided in patients with a history of urinary retention. The other drugs listed are not TCAs. The nurse is providing discharge instructions for a patient on monoamine oxidase inhibiting drugs. What drugs can result in high fever, convulsions, and death when combined with MAOI drugs? A. Trazodone. B. Doxepine. C. Acetaminophen. D. Vitamin C. The correct answer is B. Doxepine. Explanation. B. Doxepine is a tricyclic antidepressant. When doxepin is taken with monoamine oxidase inhibitors, this can result in a severe adverse reaction resulting in death. The classes of drugs for mental health are important for testing. Let's keep reviewing. All of the statements are true about nursing interventions for a hemodialysis shunt. Select all that apply. A hemodialysis shunt is inserted directly into the peritoneal cavity for dialysis. B, a hemodialysis shunt requires 6 weeks to mature before it is used. C, the shunt can be used immediately after it is made. D, a hemodialysis shunt is created by surgically inserting a catheter, connecting it between the artery and vein. The correct answer is C. The shunt can be used immediately after it is made. And D. A hemodialysis shunt is created by surgically inserting a catheter, connecting it between the artery and vein. Explanation. A is incorrect because it indicates that a hemodialysis shunt is indicated in the peritoneum. Understanding the difference between hemodialysis and peritoneal dialysis allows you to rule this answer out quickly. Remember, hemodialysis shunts can be used immediately. Hemodialysis fistulas require 6 weeks to mature before use. The UAP asked the nurse about an arteriovenous fistula. The nurse correctly answers. Select all that apply. A. An arteriovenous fistula is an internal fistula surgically created using a catheter that is connected to an artery and vein. B. An advantage of the arteriovenous fistula is that it can be used immediately. C. It is important to avoid taking a cuff blood pressure above the site of an arteriovenous fistula. D. An arteriovenous fistula is an internal fistula that is surgically created. The correct answer is C. It is important to avoid taking a cuff blood pressure above the site of an arteriovenous fistula. And D. An arteriovenous fistula is an internal fistula that is surgically created. Explanation. A is incorrect because an arteriovenous fistula is surgically created using the patient's artery and vein. A catheter is not used. A catheter, also known as a graft, is used to create a shunt. It is a subtle but important difference in terminology. Arteriovenous fistulas require about 6 weeks to mature. The UAP asked the nurse about peritoneal dialysis in a renal failure patient. The nurse correctly answers. Select all that apply. A. Peritoneal dialysis is usually done once a week at a hemodialysis center. B. Peritoneal dialysis involves placing a sterile peritoneal dialysate solution into the abdominal cavity. C. A daily peritoneal dialysis session usually takes about 20 minutes from start to finish. D. Peritoneal dialysis solution that is infused into the abdominal cavity must be sterile. The correct answer is B. Peritoneal dialysis involves placing sterile peritoneal dialysate solution into the abdominal cavity. And D. Peritoneal dialysis solution infused into the abdominal cavity must be sterile. Explanation. Peritoneal dialysis is usually done several times per week for adequate maintenance. Peritoneal dialysis depends on the dwell time prescribed, the time that the dialysis solution remains in the peritoneal cavity. It may be 1 hour or several hours. True or false? Patients with HIV infections have less severe COVID-19 infection. True, false, or cannot be determined.
The nurse is assessing a patient admitted to the emergency department with the black toe. This finding is consistent with what diagnosis? A. Collagen vascular disease. B. Deep vein thrombosis. C. Diabetic neuropathy. D. Gangrene. The correct answer is D. Gangrene. Explanation. When blood flow is cut off to a region of tissue, gangrene with tissue necrosis occurs. The skin turns dark or black in color. Gangrene requires immediate attention. Treatment usually includes antibiotics and removal of the dead tissue. A condition resulting when the inner lining of the aorta is torn, resulting in blood entering the layers of the wall of the aorta, damaging the aorta, and potentially resulting in rupture. This finding is consistent with what diagnosis? A. Myocardial infarction. B. Aortic dissection. C. Mitral valve rupture. D. Pulmonary embolism. The correct answer is B. Aortic dissection. Aortic dissection may present with sudden severe back or abdominal pain, shortness of breath, low blood pressure, and loss of consciousness. Some patients die before reaching the hospital, and the mortality for untreated aortic dissection is high.
The correct answer is false. Explanation. HIV patients are immunocompromised and are in a high-risk group. They may present with more severe symptoms, and they have worse outcomes. The nurse is providing discharge instructions for a 45-year-old male with seizure disorder. What drugs should be used cautiously in this patient? A. Selexin, B. Benadryl, C. Imipramine, D. Trazodone. The correct answer is C. Imipramine. Explanation. Imipramine is a tricyclic antidepressant, TCA. The drug potentiates norepinephrine and serotonin in the central nervous system. It should not be prescribed during pregnancy. What are the nursing priorities during peritoneal dialysis treatment? Select all that apply. A. Assess vital signs before and during peritoneal dialysis treatment. B. Start intravenous fluids, normal saline, 100 cc's per hour. C. Prophylactic antibiotics may be added to the peritoneal dialysis solution. D. The catheter site and dressing should be monitored during peritoneal dialysis. The correct answer is A. Assess vital signs before and during peritoneal dialysis treatment. C. Prophylactic antibiotics may be added to the peritoneal dialysis solution. And D. The catheter site and dressing should be monitored during peritoneal dialysis. Explanation. Peritoneal dialysis is an effective method of dialysis that some patients prefer. Remember, it serves the purpose of removing excess fluid, so the nurse would not expect to infuse normal saline at 150 cc's per hour during dialysis. What are the complications of peritoneal dialysis? Select all that apply. A. Hyperkalemia. B. Thrombocytopenia. C. Peritonitis. D. Leakage around the catheter site. The correct answer is C. Peritonitis, and D. Leakage around the catheter site. Explanation. Technique is very important during the administration of peritoneal dialysis to avoid infection, peritonitis. The dialysis solution is sterile, but peritonitis is still a risk in patients receiving peritoneal dialysis. A and B are not likely complications. The UAP asks the nurse what long COVID means. The nurse correctly answers, select all that apply. Prolonged hospitalization, a post-COVID syndrome. Symptoms may continue for 4 or more weeks and are not explained by an alternative diagnosis. Symptoms occurring during the first 28 days of COVID-19 infection. The correct answer is a post-COVID syndrome, and symptoms may continue for 4 or more weeks and are not explained by an alternative diagnosis. Explanation. Long-term COVID symptoms have been referred to as long COVID or post-COVID syndrome. This refers to persistent symptoms in those who have recovered from COVID-19 initial illness. A patient is admitted to the hospital ward with acute cystitis. What findings does a nurse expect to see documented on the patient's chart? Select all that apply. A. Upper back pain and flank pain. B. Bacteria found on urinalysis. C. Lower abdominal or back pain. D. Anemia. The correct answer is B. Bacteria found on urinalysis, and C. Lower abdominal or back pain. Explanation. Acute cystitis is acute inflammation of the bladder. Usually, it is caused by a bacterial infection. Think about the location of the bladder to explain why the location of the patient's pain is different than an acute pyelonephritis. The nurse is speaking with the patient who is being treated with a mood stabilizer. What are some drugs that should be used? Select all that apply. A. Meloxicam. B. Lithium. C. Citalopram. D. Furosemide. The correct answer is B. Lithium. Explanation. Lithium is a mood stabilizer and is an important drug in the treatment of bipolar disorder. However, the drug must be monitored to ensure that the level of the drug is within the therapeutic range. The nurse is interviewing a 65-year-old female patient with suspected COVID-19. What symptoms are suggestive of COVID-19 infection? Select all that apply. Sore throat, nausea, vomiting, chills, rigors, and confusion. The correct answer is sore throat, nausea, vomiting, chills and rigors, and confusion. Explanation. Notice in this question, the patient is 65 years of age. Older patients with COVID-19 have a higher risk of death from COVID-19. The nurse is caring for a patient who is being treated with lithium. What drugs will the nurse caution the patient about that may increase lithium blood levels and toxicity? Select all that apply. A. Furosemide. B. Aspirin. C. Fluoxetine. D. Azithromycin. The correct answer is A. Furosemide. Explanation. The only drug listed above that will increase the level of lithium in the blood is furosemide, or Lasix. Use of diuretics and NSAIDs may increase the level of lithium in the blood. How did you do on these exam questions? Check out the links below this video for some great resources. The nurse is interviewing a 42-year-old male patient with suspected COVID-19. What symptoms are suggestive of COVID-19 infection? Select all that apply. Fever, otitis media, headache, dry cough. The correct answer is fever, headache, and dry cough. Explanation. On the exam, it is important to pay attention to the age of the patient. It may be a clue that will help you select the correct answer. Otitis media is not a typical presenting symptom in COVID-19 patients. What are some cardiac complications that may be typically reported with COVID-19? Select all that apply. Myocarditis, ventricular hypertrophy, heart failure, mitral valve stenosis. The correct answer is myocarditis and heart failure. Explanation. Complications of COVID-19 include a number of cardiovascular conditions, including myocardial injury, myocarditis, myocardial infarction, heart failure, cardiomyopathy, arrhythmias, and cardiac arrest.
A patient with a history of chest pain is admitted to the hospital with inflammation of the outer covering of the wall of the heart. This finding is consistent with what diagnosis? A. Pericarditis. B. Endocarditis. C. Cardiomyopathy. D. Congestive heart failure. The correct answer is A. Pericarditis. Explanation. Acute pericarditis may be of viral origin or the cause may be undetermined. Symptoms include chest pain, a pericardial friction rub that may be heard on auscultation, pericardial effusion, or ECG changes. What diagnostic study involves injecting dye so that the coronary vessels can be seen using X-ray or fluoroscopy? This allows the cardiologist to diagnose coronary artery disease. A. Computed tomography. B. Echocardiography. C. Angiography. D. VQ scan. The correct answer is C. Angiography. Explanation. Angiography is a medical procedure involving the injection of radio-opaque substance into the blood that can be seen by radiography. The images that allow us to see the coronary blood vessels are called angiograms.
What are some dermatologic conditions associated with COVID-19? Select all that apply. Onchocerciasis, urticaria, xanthomas rash, psoriasis. The correct answer is urticaria and eczematous rash. Explanation. Although the most significant complications of COVID-19 are pulmonary and cardiac, there are a number of skin conditions or dermatologic conditions seen such as hives, urticaria, maculopapular rash, vesicles, petechiae,